If you own a dental practice and you want to get more new patients into your practice, then it's absolutely critical that your staff learn how to master the use of a transition statement. Hi, I'm Andrea, and today we're going to learn the basics of how to use a transition statement, what it is, and how your staff can use it to have better conversations with new patients to ultimately book those new patient appointments in. A transition statement is just one simple sentence that allows the receptionist to take control of the conversation so that the call goes more smoothly and is more engaging. Oftentimes, a new patient will call your practice and they'll say something like this: "Hi, do you do dental implants?" And the receptionist will respond back with, "Yes, we do." "Okay, how much do you charge for dental implants?" At this point, receptionists and dentists often think that this person is a price shopper. Well, we thought the same thing as well until we learned from our friends at All Star Dental Academy that this isn't really the case. They're actually asking, how much does this service cost? Because they don't actually know what else to ask. The problem is that in many cases, receptionists also don't know where to take this conversation after this point. They don't know how to have great dialogue with the patient, take control of the conversation. We've listened to thousands of dental calls, and this is what they usually sound like. "Oh, well, I'm not really sure. You'd have to come in and see the doctor for a consultation." The problem with responses like this is that it doesn't lead anywhere, and patients often feel like you're just trying to sell them and get them in the door. On the flip side, giving the patient the price also doesn't work either. We often hear receptionists say, "At our dental practice, dental implants cost around $3,000 per tooth." After this, the patient will usually say, "Okay, let me think about it," and they hang up. We don't know the patient's name. We don't know the patient's phone number or email to give them a call back and follow up. We don't know if they're missing one tooth or multiple teeth. We have absolutely no information on this patient whatsoever. Now let's look at what this conversation could have sounded like with the use of a simple transition statement. A transition statement is literally just one simple sentence that sounds like this: "I can definitely help you with that. Would you mind if I ask you a few key questions first to better assist you?" Now the patient is very likely to respond back with, "Sure, okay." At this point, the receptionist can say, "Great, well, my name is Andrea. Who do I have the pleasure of speaking with today? And would you mind giving me your phone number in case we get disconnected?" Because the receptionist used that one simple sentence, they now have control of the conversation. They're able to ask a bunch of discovery questions. So those investigative questions like, how did you hear about us? Are you calling in for yourself or for somebody else? How many teeth do you currently have missing? Because you used that one simple sentence, you're able to build a relationship of trust with this patient. So even if the patient doesn't book on this initial phone call, they're going to remember how you made them feel on this conversation. They're going to remember that you built rapport with them and that you engaged with them about their problems, their issues, their concerns, and they're going to feel like they can trust this person. And people typically tend to buy from people they like and people they trust. If your staff isn't well trained and doesn't know how to, use a transition statement over the phone to take control of that conversation, we could send you, let's say, 10 leads a week, but your staff may only be able to secure 2 or 3 out of those leads. Whereas another dental practice who is spending the same amount of money on marketing but has a staff that is very well trained on the phone may be able to secure 7 or 8 of those new patient leads. So it's important to always make sure that you have a staff behind you that is able to support you. That way, when it does come time to hiring a marketing company and they give you that fantastic website, you and your staff are able to handle those new patient leads that are coming your way.